Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
I welcome one and all for this class on OSCE today. And remember, it's going to be a mock OSCE practice tonight. So I'll be showing you the questions and I'll keep quiet. I'll give you 4 minutes. Write it down, write down the answers on a pen, paper, and click the pictures and send me the answers. Okay. I'll be very strict with the time because that's how much time you're going to get. All right. And I start with the first question now. Your time has started, guys. Okay. All right, guys, the time is up, and it's very good that right at the beginning of the class, I have such good responses from so many people here. So you people have written down pretty, correct answers, and you've also been very meticulous with time management. So both the things are equally important. You have to be very precise with the time management, and you have to be correct with your answers. Now let's go and discuss the answers for this picture. And everybody who gets a little upset by seeing the picture is not able to diagnose the picture, please do not get worried. Why? Because usually you get a hint in the questions asked. Okay, so that is very important. All of you just look at the question once properly and you'll be able to find out the answer. So let's discuss this. Write the ideal period of gestation in which cervical length is assessed in a singleton low-risk pregnant woman. Most of you have written down 16 and 24 weeks. 14 to 16 weeks, isn't it? But ideally, cervical length is seen at the time of the level 2 anomaly scan, most of the time. Okay, most of the time, though of course you can't do anything at that time, probably if the length is less, but yes, you will see the ideal time is to see at that particular place. So write the ideal period of gestation which cervical length is seen. This is the ideal period between 18 to 24 weeks. Okay, not 14 weeks. 14 weeks you'll only see for a patient who had a history of preterm births, recurrent pregnancy losses, previous history of leads, or you have in which you have a reason to scan or a reason to follow up the cervical length to give cervical cerclage at the right time. Okay, and usually you don't do that for low risk population. No. Then the question was, mention 4 prerequisites for measuring the cervical length by ultrasound. So see, most of you have written empty the bladder, but let me tell you, when you're doing the TVS, the transvaginal scan, you need a little bit of bladder to be filled. Why? Because you need to localize when you're doing ultrasound, transvaginal ultrasound. The landmark bladder has to be precise. Okay, the entire orientation of the ultrasound is based on where the bladder is. So yes, some amount of fluid should be there in the bladder, completely not completely empty, partially filled bladder to avoid distortion of cervical anatomy, and at the same time to stand as a landmark. Number 1. Second, the position of the patient should be in dorsal supine position, preferably not in a lithotomy position, just a dorsal supine position will be fine. Probe that use is usually transvaginal ultrasound probe, and ensure visualization of both the internal loss and the external loss. Okay, so I'm not going to read out your answers, and I will never pinpoint to any of my students, so feel free to send your answers. Okay, the idea is to give you a practice of time. Nobody is criticizing anybody, nobody is making any comments on anybody else over here. All of you are equal for me, and all of you are working very, very hard to achieve whatever you are aiming for your DNB. And I want everyone to be prepared for the DNB practical, which is the reason why I'm giving you time limit of this time, so that you are able to adjust yourself for the exam. Now, so these were the prerequisites. Now let's talk about the prophylactic measures. Was it? Just a minute, guys. So yes, write the management of a patient with cervical length less than 2.5 centimeters. What will you do? Mostly when a patient gets a cervical length less than 2.5 centimeters and does not have any further risk factors, that means she does not have any history of preterm losses, nor is she a candidate of large loop excision, nor she's had any cervical operations, nor a previous cerclage, nothing. Just an incidental finding of less than 2.5 centimeters. You will only give her vaginal progesterone. Okay, everybody, please remember, this is the latest guideline. You will give her the latest vaginal vaginal progesterone 200 milligrams daily, basically to reduce the preterm birth rate, number 1, and cervical cerclage only for those patients who've had a previous history of preterm loss. This is in the guidelines, okay? The green top guidelines, the guideline which we all consider the biggest guideline, okay? So yes, this is what you'll do. You will give the cervical cerclage if there was a history of preterm loss, and also the cervical length is going less than 2.5 centimeters. So you can give cerclage at any point before 28 weeks, not after that. Right. I'm sorry. Okay, guys, are you ready now for the next question, everyone?